From the patient's perspective, not having to travel, significant distance is a big deal, especially when patients are frail and ill. It's great for them to be able to go to their local health center, or in the case of our telehealth monitoring program, to be able to actually monitor, self-monitor, and be connected into to nurses just right from their home.
I have a couple where they're seniors living on their own, so they find that really reassuring to know that, there's someone out there reviewing what's happening with them in terms of their data. I have a couple where there's a spouse that's more the caregiver, and that can be very stressful, caring for a partner that has a chronic condition, and if they're particularly fragile, I think it gives the caregiver a lot of support and a lot of reassurance as well.
When we started, there were a number of challenges. We weren't sure how our patients would receive it. Most of our patients are older patients who may not be technologically facile. They may be hard of hearing, they may issues like that. But we have a nurse on the other end, and the patients take to it immediately.
What we're telling patients with heart failure are the same things. You need to be weighing yourself, you need to be watching for these things, and this is what you're looking for, and this is when you need to seek help. The difference is that what they're actually doing in their home is being transmitted and looked at and potentially responded to by a healthcare worker.
Innovations are, we have a provincial program, and we're on contract. We have an electronic medical record. On my little stick here, I have access to every detail on all of my patients. All my hospital data is transferred in here. All of my chart works here. We do this Telethoracic, and we have a nurse practitioner. So those are the innovations that are working for us.
I'm a real firm believer that you always put people and process before technology. And it's not about the telehealth technology, right? For me, it's about where the need is. And I think for someone who's going to support telehealth, the delivery of health services over telehealth, they need to be mindful of that. Wherever the need exists, and that's kind of the approach we've taken, wherever the need exists, that's where we invest.
The provincial program kept me at it because it's been so enjoyable to work in a collaborative model where we're on contract and we're not competing fee for service. And as a personal aside, I think it's the salvation of Canadian medicine. I mean, we've got to go to some form of contract where we work together collaboratively.
I really believe we will get into primary care type visits. So there's some barriers there today around reimbursement for physician time, and there's barriers to the way we do business today. But I think as the models of care change, we will get more and more involved in primary care telehealth.